Hello and welcome to Askimo TV. I'm talking today to Dr. Bruce Okoye. Dr. Okoye is a consultant pediatric surgeon at the St. George's Hospital in London, the Royal Marsden Hospital, and the Portland Hospital for Women and Children. He specializes in all aspects of pediatric surgery. He has a particular interest in surgery for childhood tumors. Hi, Dr. Okoye. How are you?
I'm fine. Good morning, Joanne. How are you?
Very well, thank you. Dr. Okoye, today's discussion is going to be about abdominal tumors or neuroblastoma in children. So what is neuroblastoma?
Neuroblastoma is one of the commonest tumors in children. It is most commonly occurs in the abdomen, and what it is a malignant tumor of nerve cells. These are primitive nerve cells that should have developed into nerves of the sympathetic nervous system, but instead they develop into a rapidly growing tumor. But these tumors are quite special in that although they can start off as malignant, very often they can mature and develop into a more normal kind of tissue which stops being a tumor. It can occur in the abdomen. That is the most common place that it occurs, but it can also occur in the chest and in the neck.
What causes this tumor and who's at risk?
Unfortunately, we don't know what causes this tumor. It is a failure of development and essentially things that signal cells to develop into more from primitive cells to more mature cells and ask them to stop growing. These genetic defects or these clicks in the body fail to control the growth of these cells. So rather than develop into normal cells, they turn into a tumor. But we don't completely understand why this happens at all. Some children with some particular genetic defects are prone to developing neuroblastoma, but more often than not, there is no associated syndrome at all.
What are some of the signs and symptoms of neuroblastoma?
It has quite a varied means of presentation. Again, the most common way that this is picked up is with a big lump in the tummy. And this is often just picked up by the parents on giving the baby a bath or a cuddle, and they notice, oh my goodness, there's a big lump in the tummy. But also, unfortunately, with neuroblastoma, they can present with distant spread of the tumor. So they may present with lumps on the scalp, or bruising around the eye, or a bulging of one of the eyes. And occasionally they can have problems passing urine or opening their bowels if they have a lump in the pelvis. But most commonly they present with a lump in the tummy.
How is this tumor diagnosed?
The most important thing, of course, is clinical suspicion. And unfortunately, if they present with the less typical symptoms, there may be a delay in diagnosis. But again, fortunately, a lot of the time they present with a lump in the tummy, and the doctor will then refer for an ultrasound scan, which will show that there is a lump in the tummy. And after that, there should be a quick referral to a specialist center where a multidisciplinary team consisting of surgeons, oncologists, pediatricians, we get together and have a look at the scans and then decide on the best way to make a diagnosis. And usually that consists of taking a piece of tissue as a biopsy under an anesthetic, which is then sent off to the pathologist to make a diagnosis.
Tell me briefly about the treatment options and what is done to help.
These children are treated by a multidisciplinary team, which consists of oncologists and surgeons, etc. What usually happens after the diagnosis is made is for some tumors which are not very large and which are easily removed completely, then surgery is the best option to get rid of these tumors. For those which have spread or for which surgery is deemed to be too unsafe because of the high risk of bleeding, for example, or damage to other structures, then these children undergo very intensive chemotherapy, sometimes radiotherapy, followed by surgery. And in some extreme cases, the children need to have very, very intensive chemotherapy and subsequent bone marrow transplant. And that is because the intensity of chemotherapy that they have to have is so heavy that it destroys the bone marrow, and so subsequently they have to have a bone marrow transplant as well.
What is the prognosis for recovering from tumor?
The prognosis for neuroblastoma really varies depending on the stage of the tumor, but also on the nature of the tumor, looking at it under the microscope. Some type of tumors have a worse prognosis than others, depending on certain genetic markers within the tumor itself. So for the best cases, the localized cases, they can have a survival of in excess of 10%. But for the children who have got a spread of their tumor or who have unfavorable genetic markers, then I'm afraid we're still battling with poor survival of about 40% after 5 years for those children.
Thank you, Dr. Okoye. Thank you so much for speaking to me today.
Thank you, Joanne.